I recently had the privilege of conducting a webinar sponsored by AetnaCVS for behavioral health professionals as well as other health professionals. I conducted this webinar together with Dr. Christine Moutier from the American Foundation for Suicide Prevention. And we were covering suicide prevention in health systems, sharing thoughts, some of which are contained in a recent book that we published by Cambridge Press. And a question came in that was so good, but we didn't have time to address it during the webinar, so I wanted to provide some thoughts here. Here was the question. How do you widen the circle of involvement among other healthcare providers, in particular PCPs and OB-GYNs, when they're overwhelmed with treating patients and share that identifying mental health issues and suicide puts them at risk, since it's so hard to connect their members with mental health professionals and counseling? Great question, huge question. Let me give a few thoughts about that. I actually have 5 thoughts about how to involve healthcare professionals when it comes to addressing suicide risk and helping people recover. So the first thing is, if you do get a referral where you know a primary care provider is involved, let them know the outcome of that referral. Primary care providers that I know really want to hear if they make a referral whether that comes to pass or not. That includes if you saw the person or you didn't see the person, if the person never was able to connect. Second, communicate after the first visit and ideally in an ongoing way. A 3 or 4 sentence letter dictated will do it. If you do share electronic medical records, even better, sending a quick follow-up, letting them know what's going on, or just share a copy of your note. This builds confidence and teamwork and lets the providers know that you think their role is important in addressing this person's suicide risk. The third, and this is very practical, describe the role you would like them to play. Many times primary care professionals don't know exactly what the expectations that the behavioral health professional has of them. So it's very helpful. So for example, in our webinar, we covered prevention-oriented risk formulation, which includes addressing foreseeable changes, identifying and addressing things that could change in the person's life that could make things worse for them when you've identified suicide risk. Well, letting the primary care provider know, hey, here are the 2 things we identified that could make risk increase quickly. Could you be on the lookout for these 2 things and let me know if you see them? So that way, it's not diffuse about what their role is. Their role is when they happen to see the person, that gives them something to ask about. I know that when you were working with your behavioral health provider, you identified these 2 things. Where are you with those? That's so much better, and gives the client, the patient, the idea that, wow, people are really working together and are asking me, person-specific things about me, not just general check-in questions. This goes kind of right along with it. The 4th thing is to support and encourage training. There is really good evidence-based training for primary care professionals available. And it's kind of amazing that this question comes in because literally last week, after a primary care suicide prevention training, we heard this from one of the professionals. I didn't realize I could be such an integral part of helping a person find help and come up with a plan. Many times primary care providers have just been told that their role is to identify and refer. But if you can give a substantive role, many people want to play that role, especially if it's in collaboration with you as a behavioral health provider. Finally, if you stop seeing the person, let them know that too. It's very common story that and very uncomfortable for a primary care provider who thinks that the person that they're working with is in behavioral health care, is being seen regularly, only to find out months later, no, they're not there, they're not being seen anymore, and I'm the only point of contact. So closing that loop, whether the person sort of fizzled out and stopped coming, or you kind of formally decided that the person would no longer need treatment, either way, letting the person know. Now, these are things that have to be built into routines. It's not something we're just going to remember, because in that day in, day out, working, trying to address these complex needs, it's not going to happen unless we have routines for it. And so build these routines into practice. Number one, let primary care know the outcome of a referral. Number two, communicate initially, but also ongoing if possible. 3, be very specific about the role you'd like them to play, with the example of, looking for foreseeable changes and letting you know if they've happened. 4, support and encourage training for primary care professionals. 5th, if you stop seeing someone, let them know. So hopefully that's making good on my promise to answer this question during the webinar. I know that the folks at AetnaCVS will disseminate this to the people who were in the webinar. And so thank you again for that great question, and I hope this is helpful.